Welcome to Health Matters, a program featuring healthcare professionals teaching you how to take charge of your well-being and to let you know that God wants you to be healthy. Let's join the discussion now. God bless you.
Hello viewers, you're welcome to Health Matters. I hope you're keeping healthy. Once again, we are here with a medical doctor to share his thoughts with us on a topic that I believe is going to be of interest to all of us. I have with me here Dr. Adelala Aragbaye. He is a resident doctor with Lagos State Teaching Hospital. He has a strong passion for souls and for missions. Doctor, you are welcome,
yes,
sir.
Thank you, ma'am. Good afternoon, ma'am.
Viewers, I want us to be relaxed. If you have not subscribed, please subscribe. Make comments, share, call up your friends as we dig into the topic of today. Our topic today is a topic that I believe would really be of interest to us, and that is cervical cancer. From the research that we have studied and looked into, we're told that cervical cancer is the highest and the most prominent of all cancers that affect women all over the world. So I believe that as believers, we need to look at it. We need to see what causes it, how can we prevent it, and how can we treat it. And that is why we have with us Dr. Aragbaye. We believe that he will be able to trash this issue with us and give us deep insights that will be of help to us today. Doctor, once again, you're welcome.
Thank you, ma'am.
What is cervical cancer?
Cervical cancer is the cancer of the cervix. The cervix is between the junction between the womb and the upper part of the vagina. So cancer around there is called cervical cancer. Between the womb
and the upper part of the vagina?
Yes.
Okay.
So it can only occur in women because men don't have a cervix, yes. Okay. So it can only occur in women. Okay. So it's one of the leading causes of cancer in women, one of the leading causes of cancer in women.
All over the world?
All over the world.
Oh, okay.
So it's something that is worth looking at, actually.
Thank you, sir. So what causes this cancer, this cervical cancer? What causes it?
Well,
the cause?
Should we be talking about predisposing factors that could make increase the risk of someone coming down with cervical cancer? Yes, in so many cases of cervical cancer, HPV, human papilloma virus 16 and 18 have been actually implicated. So, and there are also other factors that could actually increase the risk of someone coming down with cancer. For instance, people with multiple sexual partners, they are at higher risk of contracting HPV.
Multiple sexual
partners are higher risk of contracting the HPV virus. Okay. Then multiple childbirth, multiple deliveries. Yeah, it's also a risk factor.
So that means if you have like 5, 6...
Yes, it's a risk factor for cervical cancer.
Children.
Then smoking.
Okay.
Actually, smoking is implicated in most cancers. Smoking is implicated in most cancers. So
by drinking alcohol?
Yes, alcohol too, in so many other cancers like breast cancers, cancer, ovarian cancer too.
But it's not so much.
Yes, this emphasis on smoking for cervical cancer. Then family history. Like
that means
a close relative coming down with cancer, yes. One is at higher risk. That a close relative has had cancer, cervical cancer, doesn't mean that someone is going to come down with it, but it has increased the risk of it for such individual.
Okay.
Yes.
Okay, let's take it one by one, doctor. You said multiple sexual. When you say multiple, we look at maybe prostituting now. But
okay.
could it also be that maybe a woman that started having sex in early age. I just want you to explain that part.
Early exposure to sexual intercourse.
Okay.
Yeah, can also increase the...
Like from teenage years?
Yes, from teenage years. And also being in sexual relationship with an unfaithful partner. Because if the partner is sleeping with so many other persons, so that individual, yes, he or she is faithful in that relationship, but it also passes for someone that has a multiple sexual partner, because our partner is sleeping with so many other persons.
Then that makes me to ask you a question. Is it that it's like a sexual transmission?
Yes, HPV, human papillomavirus, can be contracted through sexual intercourse.
Ooh.
Yes.
Yes, are we hearing that?
So
through sexual intercourse, you can actually pick up
human papillomavirus. So that has been implicated in so many cervical cancer cases.
So through that, you can actually have ovarian cancer.
No, cervical
cancer. Sorry, sir. Cervical cancer. Then you talked about the issue of multiple children.
Yes, epidemiological studies reveal that cervical cancer is higher in people with that have had multiple deliveries.
Why so, sir?
Maybe due to the disturbance of the cervix, because each time someone gives birth, the cervix has to dilate, and also so over time, it's been discovered that it's also a leading risk factors for cervical cancer. Yes.
Then you talked about the issue of smoking, of taking
smoking, alcohol. Yes, and
so that means if you are working in a place where there's so much smoke, the tendency that you might have, or if you are into cooking and all of that, could that be? Because I don't want to talk about. No. I don't want to see it as cigarettes.
No, it's cigarettes.
Okay, it's about cigarettes now.
Yes, about cigarettes, drug abuse, and all that.
Okay.
It's what we are talking about.
Okay, it's not just that you are exposed to smoke.
No, not at all.
Okay, it's when you actually take cigarettes. I want our viewers to hear that as when you take. You can say, okay, this is the Believers channel, but at the same time, it's good for us to note and to let us know that these are things that can actually stir up this form of cancer in us. Then you said family history.
Family history. Hereditary, yes. So, like I said, there are some modifiable factors. Like unmodifiable factors, that factors that you can't do anything about. Like family history of cervical cancer, there's nothing you can do about that. So, but the aspect of smoking and number of deliveries and all that, yes, you can actually stop smoking and reduce your risk for cervical cancer.
Thank you, doctor.
Thank you, welcome.
We've looked at the causes, then we want to come to the issue of how can we prevent it. Now we know the causes. Okay, the causes can actually lead us to the issue, but let's talk about it, the ways to prevent us from this cancer that is ravaging the female gender all over the world.
Okay, prevention. All cancers are better prevented than attempting curing them. Because most of the time when the symptoms are beginning to manifest, they may not be curable at that point. So, and that's why in other climes, so much of investment are being channeled towards prevention.
Okay. Let me just pause you before you go into the prevention. Is it curable?
It depends on at the point and the severity of the disease or the stage of the disease at presentation.
At presentation.
Okay, so as presentation means that when the patient is coming to the doctor, what stage is the disease at that time? So that will determine if it's going to be curable, if the person is going to be cured or not. Yes, if it's already at stage 4, there's little or nothing.
For stage 1?
Stage 1, yes.
It's curable.
It's curable, yes.
So the prevention, sir?
Prevention, yes. Like I said, investment has been made towards prevention and early diagnosis. So there are 2 ways that this is being addressed. One, awareness. People should be aware that there's something called cervical cancer. That's number one. Then number two is through vaccination.
I would like you to talk about that.
So vaccination is for women of reproductive age from age, say, 10 to 26. So
as early as that?
Yes. Within that age bracket, people can actually opt for vaccination against human papillomavirus 16 and 18.
9 years to what age?
To 26 years.
26 years. So
Yes.
after 26, you can't take the vaccine?
Yes, after 26, it will be advisable to continue with pap smear screening.
After 26?
26 years. So, yeah, some school of thought says that from 21 years to 65 years, you commence women should commence a pap smear screening every 3 years. Yes. So that is if all things being equal, if there is no any abnormality and all that. But at any point that the abnormality is in the pap smear is recognized or is discovered, so patients can be referred to specialists that will take it off from there and probe further, may do biopsy and look at risk factors and all that to know the next line of action. So, like at 65, if there have been no abnormality in all the tests done, then at 65 you stop. The women will be asked to stop. But if there is any abnormality in all the tests done, then the clinician will advise accordingly on what the patients should do.
Doctor, can I ask you, have you had cases of women with ovarian cancer,
cervical cancer,
of cervical cancer, of the older women? Have you had cases of like from 50?
Yes, age is a risk factor. So because most of the time, many of these cancers manifest as old age. And that's one of the unmodifiable risk factors, because everybody ages, and there's nothing anybody can do about it. So most of the time it manifests at old age, beyond 50, 60 years. Most cancers, but these days there's this trend of people coming down with cancers at tender age, but still at that, more people come down with cancer at advanced ages.
Have you had cases where we were able to cure some of these?
Like I said, once you start seeing symptoms, you can be so sure that the cancer is beyond stage 2, likely stage 3 or 4. And at that point, it's always difficult to do anything about it, because the cancer must have left the cervix, must have spread to other organs.
So stage 1. Then I think we didn't really mention symptoms. What are the symptoms? What should a woman that is watching us now?
So we have classical signs of anyone having cancer. Most cancerous or cancer patients will come down with weight loss. Just realize that. But that doesn't.
Even at stage 1, doctor?
No. At advanced stage. At stage 1, one may not really have. Yes, that's why we emphasize screening. Going for screening regularly, every 3 years, or as advised by.
From the ages of 9.
No. 9 to 23 is for vaccination. Okay, but the screening is from 21 years to 65 years. Yes. So when you go as at when due, it's really unlikely to miss it. Without the.
So stage 1, you will not really have any.
No. You may not really have.
Say from stage 2.
Stage 2, stage 3. Yes, stage 3. Then one may start having a postcoital bleeding, that is bleeding after stress, weight loss, the immune system will be down, So at that point, then one would need to go through
weight loss, blood after
sex. Sometimes we even have unprovoked bleeding.
Like as if you have.
Yes. So at that point, one may not start having symptoms of metastasis, depending on depending on where the cancer has gone.
Okay.
If the cancer has spread to the bones of the back, if it's spread to the womb, if it's spread to the ovaries, it's spread to surrounding, we have bloatedness, one may have constipation, one may have severe back pain. Sometimes it can even go to the liver. Then, so the symptoms that the person will be having would be peculiar to the organs. Organs
Out of
that
all
have
the
been
symptoms,
yes.
for viewers that are watching, which one can they quickly? Because I'm saying, look, because what this is all about is how we can prevent our people from dying.
So if we are talking about prevention, we'll not be looking at the symptoms.
What do we look at? What symptom do you think you can easily pick?
We'll not be looking at the symptoms. We're looking at encouraging people to go for screening, even when they are not having any symptoms. So once all those symptoms start manifesting, then we might have lost it.
Might have lost it.
Yes.
Ooh. So it's more about prevention.
Prevention, going for screening. If you are still within the range of age of vaccination, get your vaccination. Just that presently in the country, there's no program concerning that, but there are a lot of organizations that are sponsoring that. You can also walk into any established health facilities and discuss the possibility of you getting vaccinated. Even if they are not doing that, they should know where to point you to.
For viewers that are watching, please, we need to really talk to one another. That's why we have these health matters on Rebel and Information. Number one, if you have a daughter that is from ages 9 to 21, 26, like Dr. Aragbaye has mentioned, let's let them have the vaccine. They can always get it from the hospital, sir.
Yes, most hospitals.
Teaching hospitals or even regular private hospitals. Vaccine your daughters, please. It's very important. And then if really they are of that age, into marriageable age, then every 3 years there is a need for us to do what we call pap smear test. You do this from that age till you are 65. Every 3 years or max 5 years. Just check yourself, because he has mentioned something very key now. It is better to prevent cervical cancer than for you to treat it. By the time the symptoms begin to show, like you said, it might not be curable. You can only manage it. And when you talk about management, how long can you manage?
It depends on the stage. The person might be granted what we call an end-of-life care. Just making the person as comfortable as possible. So treating the symptoms. If it's vomiting, you give anti-vomiting drugs, just to make the person...
Is it like that person will be able to be active anymore?
Depending on the stage. And the areas that...
From your experience, sir, from stage 2, 3 till, could the person still last another 10 years?
Stage 2, one may not still have any symptoms. So most of the time, from stage 3.
Could that person still live about 5-10 more years?
No, it's not likely. It's not likely.
It's not likely.
Yes.
It's a serious issue.
So once it's well established, it's just a question of time. So what you can grant the person is end-of-life care, making the person as comfortable as possible till the day of death. Call it palliative care. So there's nothing much you can do.
That we can do. That's a bit it's a bit serious, but that's the reality on ground, that we need to do all we can to prevent. Because if eventually it becomes blown up to stage 3, like Dr. have said, there's nothing anybody can do. The best we can do is to pray, and there's nothing God can do.
There's nothing God can do.
We could still be cured, but instead of us to now begin to do that, that is why God has put all this in place. That is why we are also doing this. That if you are a woman and you are above 26, please get to do the pap smear every 3. Just put it in your mind, put it on your diary. It's something that we need to do for every woman. It's very important. Doctor, thank you so much. Is there any other thing you want to tell us about this before we just round up?
Well, the essence of this is to inform people and not to go into the medical details of which will not benefit anyone. So prevention is key in the management of cancer.
Generally,
in management of cancer, prevention is better prevented or caught early. Even if it's somewhere in someone's body, if you go for screening, it will be actually discovered early, and at that point, it's actually there are a lot of things that can be done to contain it and cure it at that particular time. It's going to spare you, the family, and everyone outside with you a whole lot of stress and pain, and you have more fruitful years in the service of God towards humanity.
Is there any hospital that you probably want to mention? When people are watching and they're like, okay, where can I go? Is it to teaching hospitals? Is there specific ones that you know that you can say, okay, go to this place. Definitely you get the vaccine, or you can do your pap smear test there.
There are most teaching hospitals around would be a good place to go. And there are a lot of organizations, that are doing a lot of things in this regard to making sure that women are screened and prevented from coming down with cervical cancer. So I would say teaching hospitals.
Teaching hospitals.
Yes.
So for those of us that are watching within Nigeria, we have teaching hospitals all over the 36 states. So you can walk into any teaching hospital and tell them that you please want to either get vaccine for your daughter or for yourself to do a
pap
smear test. Please, these are very key and these are very important, so that at no time would we come down with cervical cancer. The Lord will help us. So any other thing you want to add before we just pray for the people? And can you let's join our hands and just pray. Please, I want you to just lead the prayer that the Lord, in case there's anybody watching and is going through this, that the Lord's hand should come upon the person. Please pray, sir.
Father, I want to thank you for this opportunity to discuss this with our people concerning cervical cancer and the knowledge you've given to doctors to address this. Father, we pray that maybe there are people out there that this information is already late. They would wish they have gotten this years back, but here they are. They've come down with the disease, and they've been told that there's nothing the doctor can do. So beyond the ability of the doctors, we know that we have a God up there that can answer, that can do what doctors cannot do. And that's why we are lifting up them to you, to minister the balm of Gilead to them and bring them back to their feet and take away every cancer in their system and make them whole again. This we know you will do for us. Thank you because you've answered our prayers. For in Jesus' unfailing name have we prayed.
Amen. Thank you so much.
Thank you, sir.
Before we go, I just want to say this. If you're watching us and you own a school, please kindly take this up, that you want to encourage the parents. You could put them as a group where the girls will be vaccinated. You are watching us, you are the wife of a general overseer. Please, this is an opportunity to bring this awareness to your women, especially those who are already married and giving birth, elderly ones, that the pap smear test is very important. You put them as a group. You could go to the teaching hospital or check NGOs.
There are a lot of
NGOs that are
around. A lot of laboratories around.
Let's be quiet about this. We know God is watching over us. We know that the disease of Egypt will not fall on us, but then God wants us to be knowledgeable. Let's do all we can to prevent ourselves from this scourge. God bless you. Doctor, I hope that you'll be coming back to talk to us about other issues.
By God's grace, man.
So we look forward to receiving Dr. Aragbaye again on our platform. Till then, let's keep living healthy. Let's keep washing our hands and drinking a lot of water. Please remember to comment, share, and subscribe. God bless you. See you next week.
Yes, thank you.
Health Matters, a program featuring healthcare professionals teaching you how to take charge of your well-being and to let you know that God wants you to be healthy.